Good afternoon, everyone, and thank you for joining us. We are just at the top of the hour, so we'll go ahead and get started. This is Paige Hancock, Marketing Manager at Spoke, and I'll be moderating today's webinar. Today, we'll be talking about the Joint Commission's communication goal. Katie Cornwell, Director of Clinical Marketing at Spoke, will explore some of the communication challenges hospitals face and how technology can help them comply with the Joint Commission's communication goal, also known as the National Patient Safety Goal number 2. Before we get started, I would like to go over just a few housekeeping items. Everyone will be muted during today's webinar, but we welcome your participation. Please submit your questions via the questions box, which is in your GoToWebinar toolbar, and then Katie will answer as many questions as time allows after the presentation. A recording of this webinar and the presentation slides will be sent to all registrants tomorrow, and please do feel free to share these with others at your organization. And lastly, at the end of the webinar, you'll have the opportunity to complete a short survey. We'd love it if you could take a couple of minutes to complete that evaluation because your feedback really does help our efforts to provide you with relevant and informative presentations. And with that, I'd like to turn it over to Katie, who will begin our presentation.
Thanks, Paige. Can you hear me?
Yep, you're all good.
Oh, great. Okay. Okay, thanks, everyone. Let's get started. Okay. In pursuit of its mission that you can see here on this slide, the Joint Commission audits and accredits more than 21,000 healthcare organizations and programs for clinical excellence and patient safety. They also publish an annual list of national patient safety goals that highlight specific areas of focus for improvement within the healthcare environment. A high priority on this list is improving communications because, as we know, communication delays and errors can have serious consequences for patients as well as hospitals. The rationale for National Patient Safety Goal 2.3.1 is that critical results of tests and diagnostic procedures that fall significantly outside the normal range may indicate a life-threatening situation. The objective is to provide those results to the responsible licensed caregiver within an established time frame so that the patient receives prompt treatment. 3 elements of performance for this National Patient Safety Goal include, first, development of written procedures for managing the critical results of tests and diagnostic procedures that address the following: the definition of critical results, by whom and to whom critical results are reported, and the acceptable length of time between the availability and reporting of those critical results. The second element is the implementation of the procedures for managing the critical results. And third is the evaluation of the timeliness of reporting those critical results. On this slide are a few striking statistics regarding the need for better clinical communications. Of the 24,000 malpractice cases filed between 2009 and 2013, communication was cited as a factor in 30% of them. And 37% of all injury cases classified as high severity involved a communications failure. In addition to potentially delaying critical treatments leading to patient harm, inefficient communications can increase average length of stay, reduce reimbursements, and lead to poor patient satisfaction results. Researchers estimate that U.S. hospitals waste more than $12 billion annually through communication inefficiencies. That means that a 500-bed hospital is estimated to lose more than $4 million per year. However, that study's concluding remarks do mention that, quote, information technologies and process redesign may help alleviate some of this financial burden. The good news is that such information technologies are available to help today, and leading hospitals around the globe are already successfully reducing patient length of stay, improving patient satisfaction, and tackling the critical results challenge with the help of technology solutions. Enabling mobile workflows is a key milestone in the pursuit of National Patient Safety Goal 2 and improved clinical communications. Giving mobile providers the ability to send and receive important information such as consult requests, changes in patient vitals, and test results is essential to supporting effective clinical communication. Providing the right information to the right person on the right device at the right time, enabling them to act quickly and efficiently. When we're talking about the right information, one of the main sources of that information is patient monitoring equipment. This equipment is designed to alert staff when there is a need for intervention. The ability to notify staff of changes in patient vitals allows clinicians to assess the situation more quickly and be more efficient in planning and coordinating a response. However, a common challenge for hospitals of any size is the ever-increasing number of alarms that are calling for the attention of nurses and other staff members. A study from Johns Hopkins showed that there are up to 350 alarm conditions per day per bed. So if you do the quick math for your hospital, the number is probably quite large in your facility too. Another figure we've learned is that somewhere around 90% of all of these many alarms are non-actionable. Maybe it's bad data or a bad sensor, or the alarms aren't actually set to actionable levels, or there are duplicate alarms activating at once. In other cases, thresholds may be too tight and there are false positives, and of course, closed doors make it difficult to hear and decipher alarms. So there are many reasons why alarms are activated for non-actionable purposes, but the impact is always the same. It's a waste of a clinician's time and can lead to desensitization to an alarm for the real thing. That is what is often referred to as alarm fatigue, and the risk is very real that valid alarms may be missed or disabled, leading to unnecessary complications and even patient death. Alarm fatigue was a topic of a Joint Commission Sentinel Event Alert in 2013 and is also the driving force behind the 2014 National Patient Safety Goal number 6, improve the safety of clinical alarm systems. Clearly, effectively managing alarms from the variety of care and monitoring systems used today can be a daunting task. However, notifying providers of actionable alerts quickly can be accomplished with a software solution that can prioritize alarms and send them to the appropriate caregiver on his or her smartphone, pager, or other mobile device. Additionally, reducing the incidence of false positive alarms that divert attention from the real needs of patients can also be addressed with tighter alarm parameters and proper electrode maintenance. All of this can add up to a more efficient hospital, along with a quieter, safer, and more efficient hospital, along with Joint Commission compliance. Effective alarm management can have a major impact on patient safety, especially in instances where there's a dramatic or dangerous change in patient's vital status. Or in the case of patients who are fall risks. Imagine that you hit your nurse call button for help to the restroom and no one answers. Eventually you'll give up and probably just try to get up yourself, which could lead to a fall or other accident, prolonging your stay in the hospital. Even in low-risk situations, alarm management can improve the patient experience and provide a better healing environment. Taking advantage of mobile devices and sending messages directly to appropriate staff also allows you to reduce overhead paging. Research has shown how important sleep is to patients' mental and physical health, and that a peaceful environment promotes healing. Working toward a quieter hospital can help increase your patient satisfaction scores and potentially decrease length of stay. Handling patient requests quickly and easily directly correlates to HCAHPS and patient satisfaction survey scores. And since those are now tied to reimbursement, that means that every little bit of improvement matters. Let's walk briefly through a few workflow examples. In this scenario, the nurse is being alerted to a low battery alarm. To resolve it, she must go to the bedside, assess the alarm condition, notify Biomed, and then wait for an unclear period of time for it to be addressed. Here's how Spoke can help improve Here's how Spoke can help improve the situation. We still have a low battery alarm. Oh goodness. But in this case, the notification is sent directly to Biomed. So as these images illustrate, with alarm management software, these non-critical alarms can be routed directly to the right resource. and the nurse does not have to respond to this alarm, and the issue can be addressed while she attends to more critical matters, helping her to stay focused on her patient's needs and mitigate alarm fatigue. For this example, with alarm management software, the nurse can immediately see the VFib alarm on his device. He does not have to run into the patient room to see what the alarm is and then run back out for assistance. Instead, he can call the team on his way into the patient room because he is already aware of the type and severity of the alarm. In each of these examples, the most important factor is delivering the message quickly to the right person or role on the right device. This enables the care team to take action right away, improving the experience for everyone involved. The availability of patient test results is another valuable piece of information that can improve the effectiveness of mobile workflows and enhance communication among providers. Part of the National Patient Safety Goal 2 is the Joint Commission requirement that hospitals determine reporting structures and define acceptable length of time between when a result is available and when the report reaches the right individual. It further requires hospitals to implement and evaluate procedures for managing these critical test results. Communicating critical test results to the right person can be a cumbersome process with unnecessary delays, such as phone tag and manual documentation. The numbers on this slide certainly illustrate how the sheer volume of test results can represent an important challenge to effective clinical communication. So, while the demand is very high, these tests can only help a patient's doctor if he or she actually receives the results. According to one survey, in cases where test results were cited as a factor in a malpractice case, the two most common problems were related to results never having been received, either by the patient or by the clinician. In fact, one estimate is that 75% of test result communications are not received when it comes to malpractice cases. Here's a quick look at a common critical test result scenario. A physician orders an X-ray. The results are critical. A game of phone tag begins as the radiologist tries to find the ordering physician to notify them of the results, ultimately resulting in a delay in treating the patient. Here is a much improved workflow for this same scenario. The physician orders the X-ray. The results are critical. The critical findings are pushed directly to the physician's device, eliminating the phone tag process and enabling treatment to begin much more quickly. In addition to helping lab and radiology personnel identify the right provider's contact information, a good solution can send secure text to providers on their smartphones to notify them of critical results, while maintaining closed-loop communication and escalation rules. Closed-loop communications provide traceability and accountability, while escalation rules help ensure that a qualified provider receives the message quickly and also confirms its receipt. The next two areas we will review in tandem, since you really can't talk about one without discussing the other. Providers needing to connect may not be looking for a specific person, but for someone in a position that often rotates, such as the admitting hospitalist or the cardiologist on call. In order to reach that person quickly, they must know how to reach their preferred device, whether it's a smartphone, tablet, pager, Wi-Fi phone, or something else. This is where technology is able to step in to offer assistance through an intelligent system that helps hospitals manage a variety of communication devices and roles, and to support the goal of making communications faster for better patient care. Here are two clear facts about smartphones in healthcare. First, clinicians demand consolidated messaging on their smartphones. And second, IT teams want to meet clinician requests while still ensuring security and reliability. However, there are important security and privacy challenges related to meeting those device needs. On this slide is important information captured from the Joint Commission website on sending orders for patients via standard SMS text message. According to the Joint Commission, SMS texting is not an acceptable form of messaging due to the inability to verify the identity of the person who sends the text. The Joint Commission also points out that the use of SMS-based messaging does not allow the organization to maintain an audit trail of the message content. While authentication and traceability are the Joint Commission's two main objections in this area, we should also note that HIPAA has weighed in on this topic as well, clearly stating the view that EPHI, electronic protected health information, should not be sent via SMS. Their main concern is that SMS is not encrypted, so that is another important strike against text messaging in a bring your own device environment for clinicians. There are also a number of key components missing from many messaging solutions being implemented today. First, there's a general lack of an organizationally controlled directory which can affect the security, reliability, and predictability of the communications environment. Next, if there's no built-in priority for critical messages, response times can be significantly increased. Also, separation of patient and personal information is vital as it confers security without violation of the clinician's personal device. If audit trails and escalations are supported, updates to the EMR with these transactions can help complete the patient communication story. And all modes of communication in a healthcare environment must support the protection of EPHI. SPOKE can provide all of the functionality and security elements we have just discussed. In particular, users have access to the organization's directory and on-call schedules through the SPOKE Mobile application. SPOKE Mobile simplifies communications and strengthens care by using smartphones and tablets for your hospital's secure, critical communications, including code alerts, patient updates, test results, consult requests, and more. Our intuitive app links to a powerful communication system, and with SPOKE Mobile, you can access your hospital's full directory of accurate contact information. You can send messages, images, and videos to smartphones and other devices, and you can ensure that critical communications are logged, all with security, traceability, and reliability in mind. Of course, securing PHI is top of mind for every hospital and health system CIO, and it is a key driver for implementing solutions such as secure texting. There are a number of factors that differentiate healthcare-grade applications from consumer apps like iMessage. In order to be completely HIPAA and HITECH compliant, app vendors should sign a business associate agreement. They should provide encryption of the information both in transit and at rest. They should allow for a remote device wipe in case the device itself is lost or stolen. And they should provide additional features such as screen lock and access codes to ensure the information stays secure. Everything we've talked about so far, the right information, person, and device, contributes to this final piece of the puzzle, the timeliness of communication among providers. Accessing the right information, locating the right person, and reaching that person on the right device are all essential steps that support the speed required for effective healthcare communications. Time is especially critical in emergencies such as code STEMIs and disaster situations that require coordinating a large team response. The ability to simultaneously notify all required team members on their devices and escalate to additional providers if necessary is vital to excellent patient care. And sometimes that right device is a pager. In situations like natural disasters or attacks on U.S. soil, paging remains a reliable and affordable method of communicating when cell service may be interrupted or unusable. Let's look more at this code STEMI example from IU Health. Here's a model of the process they followed for code STEMIs before implementing SPOKE. So the decision to call the code was made, kicking off an extremely time-intensive and inefficient process of manual paging, manual phone trees, and multiple contacts to ensure the right response team members could be reached and could confirm their availability. All of this added up to a 120-minute timeline from diagnosis to completion of the balloon procedure. This is a look at the much improved workflow and significantly decreased timeline down to 68 total minutes after Spoke was implemented at this site. So the code was called, the Spoke system was used to deploy the code. Staff responded with their availability, while Spoke managed the responses and escalations when required, and the whole procedure was complete within 68 minutes. So just to review the impact of implementing Spoke in this customer's code STEMI workflow, there was a major reduction in their door-to-balloon time, that key reportable metric. With that came improved response time and improved patient care. In a single step, the ER operator or house supervisor was able to notify 30 staff at once, and then the staff members responded with their status, triggering escalations and follow-ups as necessary. And then there's always an opportunity for the team to review the process after each event to identify any areas of possible improvement. So in summary, ensuring compliance with the Joint Commission's National Patient Safety Goal number 2, improve the effectiveness of communication among caregivers, is really about establishing better workflows and getting the right technology and information to the right person on the right device at the right time, ultimately giving providers a big leg up in the fight against the clock in critical situations. Technologies exist today that can significantly improve communication efficiency throughout a hospital and make giant strides towards the Joint Commission's goal to improve the effectiveness of communication among caregivers. Efficient communications do increase patient safety and satisfaction, improve provider satisfaction, and ultimately support the delivery of excellent care. Thank you all for your time and for joining us this afternoon. I'll pass it back over to Paige now for some quick announcements and for any questions. Thank you.
Thank you so much, Katie. Before we get to audience questions, I just wanted to do a quick announcement about Connect 17, which is our annual conference that's coming up really quick here. There's only a few weeks left to register. So at this conference, our agenda is full of industry topics like maximizing your EHR investment, things like Katie talked about today of improving workflows, also lots of customer case studies and just opportunities to interact with your fellow customers. So if you do have any questions, you can go to spoke.com/connect to take a look at the agenda or to register. So with that, we will go ahead and get into the attendee questions. It looks like we've had a few that were submitted already. If you do have a question, you can go ahead and submit that again using your GoToWebinar toolbar, and then we will answer as many as time allows. So Katie, our first question that came in, aside from patient monitors and nurse calls, which you mentioned, what are some other alarm sources that you can integrate with for mobile devices?
That's a great question, and the answer is that we can take alarms from just about anything in the hospital that beeps. So this also includes non-clinical systems like fire alarms and door alarms. So anything that needs to be communicated to clinicians and care team members, we can handle.
Awesome, thank you. And kind of another alerting related question, one attendee has asked, can an alert be sent to more than one person?
Yes, it definitely can. It can be sent to multiple people. So you might want to notify, like if you wanted to notify an entire care team or a specific code team. And then also in that process, the alerts can be escalated to another person if someone in that targeted role is not answering.
Excellent, thank you. Another attendee has asked, do you have any suggestions on getting buy-in from clinicians when you're rolling out a new technology?
So we've learned that the best practice really is to bring clinicians to the table early in the planning phases, just to make sure that you're covering their needs and requirements specific to that technology and also not missing something important. And then also, once the decision is made or while it's being made, market the benefits to them, and then also make sure you have plenty of staff available to help with the rollout so that you get great adoption right out of the gate.
Excellent, thank you. Another question that came in here, again, kind of related to alerts. Can nurse calls, patient alarms, and critical results be delivered to devices other than smartphones?
Yes. we can send to a variety of devices. And then depending on the role, some people may be hearing Wi-Fi phones or pagers. We're actually seeing a lot of hospitals incorporate encrypted pagers into their device mix. That lets them send patient information securely and still have that reliability. So yes, the answer is yes, and we support a lot of different devices, including pagers.
Awesome, thank you. It looks like we've got one last question here, and it seems kind of related to delivering on other devices as well. How do you handle non-staff physicians that may not have the tool, maybe referring to the Spoke mobile app, for delivering the critical results? Well,
related to that previous answer, we can support a variety of devices, and so it would be delivered probably, the information would be delivered probably in a little bit different format. But as long as we can support the targeted device, we can provide information to that person.
Excellent. Thank you so much. It looks like that's the end of our questions today, so we will go ahead and conclude there. Thank you so much for your time. And if you would like to chat with a Spoke representative on any of the topics that we discussed today, you can do so using the link that is in your chat box. You can also continue the conversation with fellow attendees by using the hashtag #SpokeWebinar on Twitter. And follow us on Twitter, LinkedIn, and Facebook to get all of the latest news from Spoke, as well as industry news and trends. Thank you all for joining us again. We hope that you found this webinar informative and that you have a great rest of your day.